Dr. Owenbrink discussing the psychological aspects of drug addiction. Psychological aspects of addiction. It's important to understand the difference between psychiatry and psychology. Psychiatrists are physicians, medical doctors, or doctors of osteopathy. They prescribe medications to correct abnormal brain chemistry as reviewed above. They tend to place an emphasis on neurochemical modifications of one's emotional and mental problems and state. They do, however, engage in some forms of talk therapy. Psychologists, on the other hand, generally have a doctorate, a PhD, in what can be considered talk therapy, which involves discussion with the patient, diagnosis forming, and a variety of different types of talk therapy to help the patient come to an understanding of different perspectives, ideas, beliefs, and ultimately feelings and behaviors. Psychological theories on why addiction happens. Addicts may engage in harmful behaviors because of concurrent mental illness. They may learn unhealthy behavior in response to their environment. Thoughts and beliefs create feelings, which in turn determine behavior. If thoughts, beliefs, and feelings are unrealistic or dysfunctional, behavior may be affected. Psychologists assume these theories apply in some way to addiction. People with these disorders might include cognitive difficulties, mood disturbances, and other mental illnesses. Addiction and other mental health disorders commonly occur together, a concept known as comorbidity. Half of the people seeking addiction treatment will have another significant mental health disorder. Many who suffer from addiction have attempted to self-treat their mental illness with available psychoactive substances, drugs, to ease their suffering. It's impossible to get somebody with comorbid conditions into good, stable, long-term, successful recovery if these other issues are ignored. That's why in our practice, we try to uncover as much as we can about what else may be going with the patient's mental, emotional, and behavioral state so that we can come up with a diagnosis of other forms of comorbid illness that need to be treated and then treat them appropriately with the right medications, not necessarily street drugs. Examples of emotional and mental disorders commonly comorbid with addiction include attention deficit and hyperactivity disorder, anxiety, bipolar disorder, depression, post-traumatic stress disorder, and various forms of trauma, including psychological trauma. The addictive personality, a set of personality traits that predispose an individual to developing addictions. This hypothesis states that there are common elements among people with varied addictions that relate to personality traits. There are several distinct personality disorders listed in the Diagnosis and Statistical Manual, Edition 5, which is the basic handbook of psychiatry and psychology that codifies all emotional and mental health disorders. Review of this document, however, reveals an absence of addictive personality disorder. There are, however, basic, informal, non-coded personality traits associated with addiction, including denial of obvious problems, problems with emotional regulation, and problems with impulse control and regulation. Psychotherapy attempts to identify and resolve underlying psychological disorders. Self-realizations and help from a qualified therapist can help uncover some of these issues. The therapeutic relationship of the patient with the therapist is critical to ensuring enough trust is present that difficult issues can be explored. Absolute honesty and diligence is required for success in any such form of therapy. Locus of control. Recognition and acceptance of personal responsibility for problems and their solutions bring to the surface deeper underlying issues. Do we see ourselves as internally directed, responsible for our own actions, or externally directed? Things just happen because they happen. We don't have much responsibility for the major events of our lives. Fate or karma seems to be the main driving force. There is a brief online test that can help determine which locus of control you believe in. This link is available in the PowerPoint presentation and the outline on the website. Nobody is entirely internally or externally directed. Generally, though, we will have a predominant belief in one versus the other as having control in our lives. Theories regarding responsibility for addiction. The medical model, people are not responsible for creating or solving their own problems. The compensatory model, people are not responsible for creating but are responsible for solving their own problems. The moral model, people are responsible for creating and solving their own problems. The enlightenment model, people are responsible for creating but not solving their own problems. What's the best way to make sense of all of this? Since we've established the genetic, biologic, medical basis of addiction and the fact that none of us can choose our parents or genetic makeup, it seems that the compensatory model fits. People are responsible for solving but not creating their own problems, thus the compensatory model. Yet, who among us hasn't behaved in a manner that worsened our addiction, made poor choices, leaving us to consider other options? We've established the biological nature of this illness, which makes the moral model less likely. Wouldn't it be great if we were not solely responsible for fixing the mess that we made of our lives? This line of thought leads us to an answer.